Welcome to Heart Anatomy. The heart is such an incredible organ. We really don't pause and consider how astonishing the heart is, but it's been estimated that the amount of work that the heart does in one's lifetime is equivalent to lifting 30 tons to the top of Mount Everest. This is coming from a muscle mass of about 300 grams, a little more in a male, perhaps a little bit less on average in a female, but the heart does all this work throughout our lifetime without taking much pause to rest. An incredible organ. Please join me on this tour of the heart. As we go on this tour through the heart, at the end of this lesson you should be able to answer the following objectives. A. Describe the pericardium and how the pericardial cavity and sinuses are formed. B. Compare and contrast the anatomy of the 4 cardiac chambers. C. List the great vessels in the cardiac chambers that receive them or issue them. D. Describe the sulfide surfaces, base and apex of the heart. E. Describe cardiac valves with regard to location and number of cusps. F. Describe the coronary circulation with regard to dominance and arterial distribution and venous drainage. G. The last objective you should be able to answer is to describe the cardiac conduction system and the clinical relevance of Koch's triangle. Middle mediastinum. The middle mediastinum is centrally located in the thoracic cavity. It contains the pericardium, heart origins of the great vessels, various nerves and smaller vessels. Pericardium. The pericardium is a fibroserous sac surrounding the heart and the roots of the great vessels. It consists of 2 components, the fibrous pericardium and the serous pericardium. 1. The fibrous pericardium is a tough connective tissue outer layer that defines the boundaries of the middle mediastinum. 2. The serous pericardium is thin and consists of 2 parts. A. The parietal layer lines the inner surface of the fibrous. B. The visceral layer, epicardium, of serous pericardium adheres to the heart and forms its outer covering. The pericardial cavity is a potential space between the visceral and parietal pericardial layers, which meet at lines of attachment on the surfaces of the heart and the great vessels. Normally, up to 50 ml of fluid can be present within the pericardial sac. Oblique pericardial sinus. The zone of reflection surrounding the veins is J-shaped, and the cul-de-sac formed within the J, posterior to the left atrium, is the oblique pericardial sinus. Transverse pericardial sinus. A passage between the 2 sites of reflected serous pericardium is the transverse pericardial sinus. This sinus lies posteriorly to the ascending aorta and the pulmonary trunk, anteriorly to the superior vena cava and superiorly to the left atrium. Cardiac chambers. Functionally, the heart consists of 2 pumps separated by a partition. A. The right pump receives deoxygenated blood from the body and sends it to the lungs. B. The left pump receives oxygenated blood from the lungs and sends it to the body. Atria upper chambers. 1. Right atrium. In the anatomical position, the right atrium forms the right border of the heart and contributes to the right portion of the heart's anterior surface. Blood returning to the right atrium enters through one of 3 vessels. These are the superior and inferior venae cavae, which together deliver blood to the heart from the body. B. The coronary sinus, which returns blood from the walls of the heart itself. 2. Left atrium. The left atrium forms most of the base or posterior surface of the heart. As with the right atrium, the left atrium is derived embryologically from 2 structures. The posterior half, or inflow portion, receives the 4 pulmonary veins. It has smooth walls and derives from the proximal parts of the pulmonary veins that are incorporated into the left atrium during development. The anterior half is continuous with the left auricle. It contains musculi pectinati and derives from the embryonic primitive atrium. Unlike the crista terminalis in the right atrium, no distinct structure separates the 2 components of the left atrium. Ventricle's lower chambers. 1. Right ventricle. The right ventricle is one of the 4 chambers of the heart. It is located in the lower right portion of the heart, below the right atrium and opposite the left ventricle. The main functions of the right ventricle are to receive deoxygenated blood from the right atrium and pump it into the pulmonary circulation. 2. Left ventricle. The left ventricle is one of the 4 chambers of the heart and is crucial for maintaining systemic circulation. It is responsible for pumping oxygenated blood to the entire body, making it the heart's main pumping chamber. The left ventricle is located in the lower left portion of the heart, beneath the left atrium, and is separated from it by the mitral valve, also known as the bicuspid valve. Great vessels. Heart veins. The veins of the heart play a crucial role in the circulatory system by returning deoxygenated blood from the myocardium heart muscle and other parts of the body back to the heart. These veins can be categorized into two main systems: the coronary veins and the great veins. A. Coronary veins. The coronary veins are responsible for draining deoxygenated blood from the heart muscle itself. They are primarily divided into two systems. 1. Greater cardiac venous system. This system accounts for the majority of venous drainage from the heart and includes coronary sinus. The largest cardiac vein, located along the left posterior atrioventricular groove, it collects blood from various cardiac veins and empties directly into the right atrium. Great cardiac vein runs alongside the anterior interventricular artery, draining blood from the left atrium and both ventricles into the coronary sinus. Middle cardiac vein travels alongside the posterior interventricular artery and also drains into the coronary sinus. 2. Smaller cardiac venous system. This includes the Thebesian veins or small cardiac veins, which are tiny vessels that drain deoxygenated blood directly into the heart chambers, particularly the right atrium and ventricle. B. Great veins. The great veins are major blood vessels that return deoxygenated blood from the body to the heart. They include superior vena cava, drains blood from the upper body, head, neck, arms into the right atrium. Inferior vena cava drains blood from the lower body, abdomen, and legs into the right atrium. Pulmonary veins. Although they carry oxygenated blood, they are significant as they return blood from the lungs to the left atrium. Typically, there are 4 pulmonary veins, 2 from each lung. Sulci of the heart. The heart is divided internally into 4 main chambers. These divisions create grooves on the external surface of the heart known as sulci. There are 3 main sulci. A. Coronary sulcus atrioventricular groove. Circles around the heart and represents the separation of the atria from the ventricles. Contains the right coronary artery, circumflex branch of the left coronary artery, small cardiac vein and coronary sinus. Spans from the medial side of the 3rd left costal cartilage to the middle of the right 6th costal cartilage. B. Anterior interventricular sulcus. Located on the anterior surface of the heart and represents the separation of the left and right ventricle. Contains the anterior interventricular artery, also known as the left anterior descending artery and great cardiac vein. C. Posterior interventricular sulcus. Located on the posterior surface of the heart and represents the separation of the left and right ventricle. Contains the posterior interventricular artery and the middle cardiac vein. The sulci contain major coronary blood vessels, and epicardial fat tends to be concentrated along them. Along with the posterior interventricular sulcus, the coronary sulcus makes the crux of the heart, or crux cordis. Surfaces. These surfaces are important for understanding the orientation and anatomical relationships of the heart within the thoracic cavity. The heart has 4 distinct surfaces, each formed by different chambers. 1. Sternocostal surface, anterior surface. This surface faces forward, upward, and slightly to the left. It is primarily formed by the right ventricle and right atrium, with minimal contributions from the left atrium and left ventricle. 2. Diaphragmatic surface, inferior surface. This surface rests on the diaphragm and faces inferiorly. It is mainly formed by the left ventricle and a small part of the right ventricle. separated by the posterior interventricular sulcus. 3. Left pulmonary surface. This surface is formed mainly by the lateral part of the left ventricle and faces the left lung. 4. Right pulmonary surface. Comprising mainly the lateral portion of the right atrium, this surface faces the right lung. Base. The base of the heart is primarily formed by the left atrium, with a small contribution from the posterior part of the right atrium. It is oriented upward, backward, and slightly to the right. The surface of the base is quadrangular in shape and is positioned at the level of the third costal cartilage. Key features of the base of the heart. 1. Orientation. The base faces posteriorly and slightly to the right. 2. Boundaries. A. Superiorly bifurcation of the pulmonary trunk. B. Inferiorly posterior part of the coronary sulcus. C. Laterally convexities of the left and right atria. 3. Major veins. The base receives the pulmonary veins from the lungs into the left atrium and the superior and inferior vena cava into the right atrium. 4. Relations. A. Laterally, the base is adjacent to the roots of the lungs. B. Posteriorly, it is related to structures such as the pericardium, pulmonary veins, aorta, esophagus, and the vertebral bodies of T5 to T9. Apex. The apex of the heart is the pointed tip located at the inferior end of the heart, primarily formed by the left ventricle. It plays a crucial role in the heart's function by facilitating the pumping of blood. Here are some key aspects of the apex. 1. Location. The apex is situated posterior to the left fifth intercostal space, approximately 8 to 9 cm from the midline of the sternum and slightly medial to the left midclavicular line. 2. Function. The apex assists in regulating the contraction of the ventricles, allowing them to pump blood effectively. During systole, the left ventricle contracts forcefully, propelling oxygenated blood into the aorta and throughout the body.